Hi, my name is Emily Pleshnick, and I'm a patient care coordinator here at Cool Springs Plastic Surgery. A day-to-day for me is helping people like me now. I'm kind of sitting here in a reverse role. I'm about to have a surgery here in a few days with Dr. Papillon. I'm having a rhinoplasty, a chin augmentation, and some chin liposuction. And day to day, I'm actually the one that helps schedule patients and talk them through, what to expect with the whole surgical process and what it's going to look like for them in recovery. And I talk to them about their goals. And so it's been a really interesting experience for me to be on the opposite side of this. And it's been a long journey finding the right place. But I know without a doubt, and that's what I encourage patients to know, that they without a doubt trust their surgeon and that they know that they're going to be taken care of with their journey. I selected Dr. Papillon. I've been researching for years, and when I speak to patients, they're often in the same kind of situation as me, that they've had this thought they wanted to do something, and then they kind of put it on the back burner, and they might talk to friends, and then they start doing research. And I had several different consultations here in Nashville. I actually had one out of state as well. And I picked Dr. Papillon. Pictures speak 1,000 words. I've seen his before and after pictures. I've seen him interact here with patients on a day-to-day basis, and I've seen his outcomes. I've had the privilege of interacting with him here and knowing how good he is in the OR and how much a perfectionist he is, and I think that's perfect, and that's absolutely a quality that's necessary in a surgeon, and he was the best one, and that's why I've chosen him.
Dr. Paul Papillon, a board-certified plastic surgeon. I wanted to talk to you about Emily's pre-op pictures. We had a consult, we have a plan. In Emily's case, you can see from her front profile, she's a very pretty lady. She has good contour, good overall facial features, and the front profile actually isn't the issue. When you start to turn to the oblique and the side profiles, you can see that Emily really has a recessive chin and also a large dorsal hump to her nasal bones. The side profile balance really throws things off in a different manner. The major goals for Emily's surgery is to give her a little bit stronger chin prominence and also a little bit better jawline and neck contour, and secondarily recontour her nasal bones and nose so that it blends better with her overall face and side profile and oblique profile. So the surgical plan for Emily is going to be 1, open rhinoplasty, 2, chin augmentation, and 3, chin and neck liposuction.
Okay, my sister's here and she's picking me up. We are getting ready to go. My surgery is in less than 2 hours and I'm nervous. Okay, we're in the car and I'm just thirsty right now, but surgery starts in about an hour and a half. And other than that, I'm getting pretty excited. Okay, I just parked. Well, my sister just parked. She's dropped me off and I'm about to walk through the door. Okay, this is the nice private pre-op room that I'm going to be in. It's got all the stuff. And there's a scale in the corner. I told them they're not weighing me. I know that they have to, but that's okay.
So this is where we are on the surgery day. The day of surgery, I took several photos. I don't like to do a lot of intraoperative speaking. Number one, because I like to focus on the patient. And I always feel if you have a camera following you around, taking pictures, it can be a little bit distracting. And I like to focus on the patient, get the job done. We can take pictures here and there, but for the most part, I would rather comment after surgery as opposed to intraoperatively. So this first photo I'm showing you is the on-table side profile of Emily. You can see, just like in the pre-op photo, she has a large dorsal hump, a little bit of fullness to the chin, and of course a little bit of recession to the chin. This next photo I'm going to show is immediately after we've done the neck liposuction. If you compare the two side by side, you can see that she has a little bit better contour underneath the chin and neck region. The issue is she still has swelling. It's not going to be the final result. However, where it is now as far as post-operatively is exactly where it needs to be. Just a little bit of improvement in the area. And then from here, we're going to move on to the chin implant. So this next photo, you can see we have a little bit of packing in the nose. We're getting ready to do the rhinoplasty. The chin implant is in place. With the chin implant compared to the previous photo, you can really see how it has kind of bolstered the area, much stronger chin. And again, what you're seeing here is a combination of swelling, immediate postoperative swelling, but still you're able to kind of appreciate the overall contour change that we're going for. The next photo is really showing everything. So here we've done the rhinoplasty, we've done the chin implant, the liposuction neck is done. Her overall contour really is just dramatically changed just with these 3 procedures, even with surgical swelling. I was very happy with the procedure, very happy with the on-table results. So for the most part, the main parts are done. And now we just have to get through the healing phase, make sure everything heals and settles the way I want to. So she's gonna go home in a few minutes from this surgery, and I'll see her typically in a week after, and then we'll kind of watch from the post-operative phase.
Okay, I'm less than 24 hours out from surgery. Slept a lot last night. You can see I'm really swollen today, especially in the chin, well, all over really, the eyes and the chin. The nose doesn't really hurt that much, to be honest. It doesn't feel a lot of anything, and the chin is just where I feel the most. But overall, I'm pretty comfortable, and I'm excited to see the results. And the swelling looks a little funny, but that's it. Okay, so I am headed in right now to go get my packing removed, and I'm very excited. They told me to take a little pain pill just in case, so I did that, and I'll keep you posted. My bruises, if you can see, are turning green, and that means that they're healing. The swelling, of course, in the jowl area has gone down a little bit, which is good. And I think I'll be getting some stitches removed out here from where the chin implant is, but I will keep you posted, and I am very excited. Okay, I just got home from getting my packing and sutures removed. I'm very excited about the results. I am so happy with them so far. I'm keeping the chin strap on for right now, and that's just following doctor's orders on that for the best healing possible. I took a pain pill before, like I said, before I went to get it removed, and I'm really happy that I did, because when you take the little stitches out of your nose, it honestly feels like you're putting a needle through like a nose pimple. It's not a very pleasant feeling at all, and I'm super glad I took a little pain pill. And the packing, when that comes out, there's just a huge sense of relief, and you can finally smell again. You can see, I'm still swollen, and they told me that was really normal still at this point, and I'm cleared to do like a full shower again, so I'm excited for that. Okay, it's 9 days out from my procedure, and you can see I have a little friend. My cat's been very protective over me since I have had this procedure done. So it is Friday, and I had the rhinoplasty, the chin augmentation, and chin liposuction done with Dr. Papillon a week ago Wednesday. So you can see the swelling is still there, just a little bit. I really have seen in the last 24 hours it go down substantially. The bruising, I went in yesterday and we treated this bruise, this bruise, and this bruise. And we didn't do this one kind of for the sake of doing an experiment, which I'm all for experiments, just to see if going in and zapping the bruise with a laser, if that really plays a big difference in how the speed of the recovery for a bruise. But if I zoom in a little bit, and excuse me, my nose is a little dry, but I've been putting some Vaseline in there. It's already started to go from the red and reddish purple blue down to the yellow, which is the final stage of a bruise. And this one is still pretty blue, purple. So I'm gonna go ahead and cover these up with makeup today and go into work. But other than that, I have this on until about Monday. I'll probably trim the edges here a little bit, and I'm really happy actually so far. I cannot wait to have this off and for the bruising to go down, and I still have a little bandage, a little steri strip right there on my chin. Okay, so today marks the 2-week anniversary that I had my rhinoplasty with my chin augmentation and my chin liposuction done. I am so happy with the results so far. The swelling has gone down. There's still a little bit of residual swelling. I'm a big bruiser, so you can see in an earlier video that I had zapped one bruise just kind of to test it, and then didn't do the other one, and you can see the one that's been zapped, that's gone away pretty much. It's just a little yellow right there, and then I'll probably just go ahead and zap this one today or tomorrow just to get that gone real quick. But I'm very happy. You can see my side profile now, and I just cannot believe it. I am so excited. I've gotten so many compliments from friends and family, and it's just exciting.
Okay, so we're 3 months out with Emily's surgical results. These are showing the comparisons, the before and afters of where we started and where we ended up. Overall, I'm very happy with her overall appearance. These photos show the majority of all the surgical swelling has gone down. However, she still has a little bit of swelling left in the nose and a little bit in the chin. Sometimes it can take up to a year for all of the swelling to come down. From the front profile, you can see Emily still looks like Emily. That's very important. Once you start to transition into the oblique profile, you can really see the results of the surgery. She has a much stronger profile. The contour and shape of her neck and jaw is much improved. The nose has a reduction in the hump, better tip position, shape, and her overall profile and appearance I feel is much better than it was before. So where we go from here, we'll watch her long term. We'll check on Emily every year to make sure things are healing well, no issues, and that'll be the plan.
All right, I'm officially 3 months out from my surgery with Dr. Papillon, and it's been awesome. I've gotten so many compliments about it. My husband, who originally told me, you don't need to do anything, you know, you look beautiful the way that you are, you know, the supportive husband type, is telling me constantly how much he loves my results and how cute my nose is. So I'm absolutely loving it. This was an experience that I was initially nervous about, and I'm just so thankful looking back at everything and how I was treated and my results, of course. So thank you, Cool Springs Plastic Surgery, for my new level of confidence.